Good morning, everyone, and thank you for joining us. My name is Sean Horrigan. I'm a Marketing Communications Associate with Commonwealth Purchasing Group. For those of you who are unfamiliar with our program, we are the leading group purchasing organization for community health centers and other nonprofit organizations. I encourage you to visit our website at cwpurchasing.com to learn about how we can help your organization save money. Today, we are very excited to have Mark Robledo, president of the Crossroads Group, to discuss measuring and improving the patient experience strategies for FQHCs and rural health centers. First, let me tell you a little bit about the Crossroads Group before I introduce you to today's presenter. The Crossroads Group is unique among survey vendors in that it implements surveys electronically and telephonically in multiple languages to ensure that the sample size goals are actually achieved across various subgroups of the population and across specialties, sites, and providers. This is an area where many vendors struggle. As a result, the firm is able to ensure that clients each have an appropriate number and allocation of surveys to support actionable reporting to key stakeholders. Since 2005, the Crossroads Group has enjoyed over 95% client retention rate and continues to expand as one of the leading providers of patient survey measurement and reporting for FQHCs, and is a valued partner of Commonwealth Purchasing Group since 2015. Okay, now let me introduce you to today's presenter. Mark Ernesto Robledo is a Six Sigma trained MBA and founder of the Crossroads Group. Prior to forming the company in 2003, Mark was a consultant leading and facilitating dozens of hospital management consulting projects by helping organizations to define and establish performance measures related to CQI projects, which he was facilitating with cross-functional teams. Some of these measures included patient survey reports, which were very flawed when measured either internally by the organizations he worked with or by third-party vendors. Due to these flaws in measurement, Mark designed and implemented actionable patient surveys for the organization he was consulting with. In this role in the early 2000s, Mark helped two hospitals achieve most improved status in their positional benchmark ranking of patient survey scores. After working with hospitals for several years, Mark began working with FQHCs in the early 2000s. Systemic flaws in patient survey measurements, combined with the unique need for FQHCs to accurately and actionably capture patient survey feedback, inspired Mark to provide TA consulting on behalf of HRSA in 2005 to help FQHCs improve their ability to measure and improve the patient experience. Recognizing the broader need among FQHCs in this area, Mark redirected the focus of the Crossroads Group from consulting towards measuring the patient experience, and the firm has since grown into the leading survey vendor for FQHCs, serving over 110 FQHCs in 26 states with reliable and actionable patient-employee survey measurement. The firm completes an average of almost 100,000 patient surveys each calendar. Today's webinar is designed to last for 30 minutes, and we will reserve 10 minutes or 15 minutes for a Q&A portion at the end. If you have a question, please type it into the chat box, and I will be sure to share it with Mark once our presentation has concluded. At this time, I'd like to hand it over to you, Mark. Thank you so much for being with us today. Why don't we get started?
Thank you, Sean, for that introduction. Great to be with you all. I'm also joined by Jocelyn Martindale, who's our consultant and advisor. She had, prior to joining Crossroads Group, over 10 years of experience with Press Ganey, and she's joining us as well to help answer questions. I'd like to start by providing you with an overview of the objective of this presentation. We're going to cover a lot of ground. I'm going to try to keep it interesting because we're going to get into the weeds a little bit. One of the things we want to cover is why measuring and improving service is important beyond compliance. And before we do that, though, I'd like to offer a polling question to learn a little bit about the needs of the audience. And the question is, using a scale of 1 to 5, where 1 is the lowest score possible and 5 is the highest score possible, how would you rate your organization's current ability to capture and use patient survey feedback to help direct organizational improvements? So how would you rate where you are now as far as measuring and then using that measure to drive improvement on a scale of 1 to 5? And feel free to include in the chat any specific areas that you'd like to see your organization improve in this regard. And we'll try to tailor the presentation towards some of those needs. So while you're completing that, a second objective of this presentation is to equip you with a core understanding of how to get the patient survey process right from the perspective of a consultant vendor who's been implementing patient surveys for 25 years. And so in those 25 years, I've seen just about everything you can possibly see when it comes to patient surveys being implemented in every way and manner possible. And so getting it right is really critical, because if you don't get it right, you can actually do more harm than good. And then gain insight regarding how to best use, assuming that you've got the measure in place, using the results of a high quality survey measurement process. And I'll share some best practices that some of our clients have shared for this presentation. So any of the polling results, okay, we've got some results here. Oh, okay. So we've got a couple people rating it as a 4, got a 3 and a 2. Kind of mixed results as expected. Nobody extremely satisfied with the process, so there's always opportunity for improvement. And Jocelyn, are you seeing any comments as far as specific areas of need?
Not at the time, not yet, but I'll keep an eye on the chat.
Okay, perfect. All right. Well, thank you all for participating in that. Just really quickly, a little bit about us. As I mentioned, I've got 25 years of experience implementing patient surveys. For me, it's not just work that I do, it's almost a calling. I mean, I've been doing it for so long and I love doing it, never get tired of it. As a company, we've got 18 years of working with federally qualified health centers in that area. Got over 95% client retention with our client base. And we specialize, unlike other vendors out there, in federally qualified health centers. That's our core market. We serve other types of organizations, but our core is federally qualified health centers, working with over 110 of them nationally on an ongoing basis in 26 states, as Sean mentioned. And what we provide, what our goal is to provide, is very actionable and intuitive reporting, so it'll actually get used. It won't just be for a quality improvement meeting, but it actually gets used throughout the organization as a scorecard to assess the organization's progress, as well as a tool that's actionable for stakeholders. Why does this matter? Well, a few quotes that are timeless. 55% of customers would actually pay extra to guarantee a better service. So clients, when a customer decides how much they want to spend, they're looking at the value. The cheaper option is not always the option that provides the most value. If you get better service, you're willing to pay a premium. It's a reason why people go to nice restaurants and fly when they can first class, because they want more seating. They're willing to pay for that service. Customer is 4 times more likely to defect to a competitor if the issue is service related, more so than if it's price or even product related. And so what does that mean in healthcare? Well, it means that the reason that patients leave is not usually the cost. It's not usually the copay or the price that they have to pay for that service. It's the service itself that causes clients to want to defect. In complaints, when you get complaints, you should consider those valuable and an opportunity to learn. And for every complaint that you get, most people will not complain. They'll stay quiet. And that's the tip of the iceberg. There's 26 other, on average, unhappy customers that are silent, that you don't know about. So complaints are really important. 96% of unhappy customers will not complain. However, 91% of those will simply leave and never come back. So those quiet defectors. We actually have clients that contact us sometimes to conduct surveys of patients that have disappeared to find out why they've disappeared. They haven't been back in 18 months. So we survey them and we find out why. And oftentimes it's a service issue. A dissatisfied customer will tell, and now this is not counting social media, will tell between 9 to 15 people about their experience. It's just funny how patients, when they're unhappy, they want to vent, they want to tell other people, they want to warn other people. About 13% of dissatisfied customers will tell even more people. So there's that squeaky wheel of patients that will tell a lot of people, and you can amplify that by 100 when you factor in Yelp and Google reviews and other social media platforms. There's a big implication here in terms of finances, and everybody cares about finances. A 5% increase in retention will increase profits by 25% to 95%. There's also similar stats related to word of mouth referrals, which is why organizations focus a lot on net promoter scores and things of that nature, because clients who are willing to promote you, that translates into revenue and loyalty. There's a lot of focus on patient-centered medical home standards, and those are important, but I just wanted to mention that they don't always correlate to service and satisfaction. So what do I mean by that is we do a lot of surveys, and in the process of conducting these surveys, a lot of our surveys include PCMH questions and service questions in the same survey. And I'm often amazed at how the two do not always correlate. They sometimes do, but oftentimes you'll see one PCMH metrics, when they become a major focus of an organization, they'll improve on the survey results. You'll see better PCMH related survey question scores, but the service and the satisfaction will go the opposite direction. So just because you've got one does not mean you've got the other. So you've got to be sure that you're providing a strong level of service to your patients, even if your PCMH compliance is excellent. In terms of culture, I see out there sometimes some complacency with executives, and settling for the status quo is not a choice. Every organization, every community health center I've worked with has in their mission statement, in their pillars for their strategic plan, there's always a service component. And yet, according to a study, 80% of executives, and this is not federally qualified health centers, this is just in general, 80% of executives think they're doing an excellent job, excellent serving customers, yet only 8% of customers agree with that assessment. So there's a gap between what executives often perceive their levels of service to be and the actuality of that. And a quality survey will illuminate that and will take away some of that complacency if it's done correctly. It's got to be done correctly, because if not, patients are not always going to be candid about how they really feel. For health centers, customer turnover is highest for patients that have choices and alternatives. And that has implications financially, because the ones that have insurance, they have more choices, obviously, and you want to serve all patients well, but your insured patients obviously will impact your payer mix, which have implications on your financial health. And it's not just about implementing a service for compliance. Many times I've seen organizations want to complete a survey because they have to, but they're not as motivated to really learn about what patients really think. Our process ensures that our clients will get the information to them about what patients truly think about the service received. And that's important regardless of how you implement the survey. I had a nurse tell me once, I was in a hospital, this was many years ago. She looked me in the eye. She knew why I was there. I was there to help them use their patient survey results and drive improvement. And she looked me in the eye and she said basically, and I'm paraphrasing, but she said, "I'm here to make them well, not to make them happy." In other words, I've got really sick people on my floor. My only concern is taking care of their health. And if they like me, great. But if they don't, that's okay too. I'm just trying to save their life. That's basically what she told me. Looked me right in the eye, and she'd been doing it for a long time. But according to many research studies, there's a relationship between service excellence and clinical outcomes. Positive doctor-patient relationships actually have a statistically significant positive effect on hard health outcomes. Okay, so they are correlated, including obesity, diabetes, hypertension, asthma, and other outcomes. When you have a provider that is serving a patient well, that patient is much more engaged with the provider. The patient is going to be more open. The patient is going to be more compliant with whatever the instructions are that they're given. And ultimately, that translates into better health. What about financials? What about the CFO that says, well, we can't afford to have a survey that's high quality? Healthcare research supports the intuitive notion that quality and finances are related in terms of patient satisfaction. There was a study done that showed that the hospitals in the top quartile of patient satisfaction outperformed significantly those that were in the bottom quartile. In fact, by almost 80% better financially in terms of their performance, and they were 82% better in terms of adjusted patient days than hospitals in the bottom quartile. So that principle holds true regardless of the type of organization. Doesn't have to be hospitals. We've seen the correlation with others as well. The health centers that do best in the patient surveys that we track often do best financially as well. What about employee satisfaction and engagement? There's a lot of talk about that lately in terms of recruiting and retention. A lot of health centers are struggling with this. They are also very strongly correlated, both anecdotally, makes sense, and by the research. In fact, the research shows that there are direct and quantifiable correlations between customer service metrics and employee engagement and retention. So if you have an organization where your employees are engaged, enthusiastic, committed, it makes sense. You're not going to have as much turnover, which translates into better patient staff interactions. They're going to provide better level of care, and out of that overflow of goodwill, that's going to pour into the patients, and then the patient positivity goes right back into the employees. So it's a positive cycle that you see. So they're very important. Jack Welch, the former CEO of General Electric, many years ago, he helped transform General Electric into an organization that was using a lot of performance measures, and they literally had hundreds, if not thousands, of metrics that they looked at very closely. But he boiled it down to 3 that were the most important, and it was client satisfaction, employee engagement, and cash flow. Those were his top 3 measures, and we're talking about 2 of those in terms of surveys, 1 of them in terms of client satisfaction. For many health centers, and I've worked with a lot of them over the years, what they're missing is something actionable, a stakeholder reporting system resulting from a high credible measurement. Now, stakeholders can include other groups, not just patients, but the main group that we're focused on today is the patient experience and having a good measure of that. I've seen health centers with terrible ways of measuring that, especially when they're doing it internally. And it's not actionable, it's not usable. Nobody even trusts the information that's being provided. And as Peter Drucker, the famous consultant, said, if you can't measure it, you can't improve it. So anything you want to improve, you really have to have a measure related to it to assess how that item is doing. We added the word well. You know, if you don't measure it well, where you can actually trust the information that you're given, again, you can do more harm than good. It can be very misleading. So before you implement a survey in your organization, some things you want to ask up front. Why are we implementing the survey? Is it for compliance? Is it for NCQA? Is it to report to a third party? Is it for a grant? What is the reason for the survey? And that's a fundamental question that will drive everything else subsequently. What do we want to learn from our patients? We always ask our clients, tell us your learning objectives. What do you want to find out? Don't worry about how you do it or how you word it. Just tell me, what do you want to know at the end of the day? That's important. What areas do we know we need to improve in? Those are good areas to focus on. You may know that you have an issue with patient wait time, but having that measure will give you that baseline so that as you implement PDSAs or process improvement, you can see the results through the eyes of your patients. Do we need different questionnaire tools or sub-questions for different populations on the survey? because there might be questions for dental patients that our medical patients don't get, but we want to learn those areas. And don't assume, this is something I see a lot in surveys designed by health centers. They'll ask questions that they don't know if the question is applicable. So in other words, they might ask, how was your lab experience? Without qualifying the patient first to determine if they even had a lab experience. So first, you always want to use a gateway question such as over the last 3 months, have you had labs at the health center? Yes or no? And then if yes, then you ask about labs, because the last thing you want is someone answering a question that they're not in any position to answer, and then you get false information. How can we benchmark standardized questions? Everyone wants to know how they're doing compared to the peer group. What methodology best represents our population? So how do we implement the survey? The methodology can really vary. For community health centers, we find that telephone surveys still work very, very well, especially for Hispanic patients and seniors and less educated individuals. If you're in suburbia and you're treating mostly millennials, then electronic surveys will often work best, or a combination of those methodologies, and we call those mixed mode methodologies, often work really well. So some groups that you might want to consider, special language groups, maybe you've got Albanians, that you're serving. Okay, well, how do we best sample Albanian patients? What about homeless patients? What about behavioral health patients that are very concerned with confidentiality, special programs, undocumented patients? We want to get their feedback. What's the best way to do that? All of those factors have to be considered. And then should we outsource this or should we do it internally? And the answer is it depends. It depends. My recommendation is if it's evaluating the service of the caregivers, best to outsource that. If you're doing market research and you want to know about preferences and future needs and access and things like that, sometimes an internal survey works really well for that because they're not rating the staff. But if patients are rating the staff, you want to give them that separation between the staff who are involved in being rated. You don't want them involved in collecting the data because patients are going to be very hesitant to say things about staff if they feel the staff are going to know what they said. If we outsource, what do we look for in a vendor? So a couple things. We are survey vendors, so we know what the questions that you want to ask are, and I want to encourage you when you're looking at options to at a minimum ask these questions. Ask them if they have standardized questions. They probably do, but then can you customize the questionnaire? Some vendors don't allow for any customization. You have to use their question set. What is your benchmark comparison size, and who are we benchmarking relative to? What is your way of potentially reaching all patients? This is a critical question that often gets neglected. So for example, some of the vendors out there only use electronic surveys. Those are the easiest to implement. Those could be email or text or both. But in that process of using electronic only, are we leaving out some people? Are we leaving out patients that don't have access to those technologies or don't have a high reading level, or as in the case of undocumented patients, would be very hesitant to fill out anything electronically? How quickly are patients contacted after the visit? Very important. The faster, the better. And then how long is your contract term? Are they going to lock you into a long-term contract that you can't get out of, even if the service is bad? We don't do that, by the way. Do you guarantee completed survey sample sizes? So most vendors will talk about attempted surveys in the sample, but they don't guarantee results. A few do, and we're one of them. Do you invoice for completed surveys, attempted surveys, or a combination of both? So what is your cost variable? And can I see samples of questionnaires and reports? So at a minimum, those are questions you want to ask. And then also, do you provide the reporting, or do you give us just the raw data to process, or do you do both? Those are all very good questions to ask a vendor. And before you implement your survey, regardless of how you do it, what sample sizes are needed in terms of the drawn sample and the completed survey count? You can use statistical sample size calculators that are online. So just Google or go to a search engine and type sample size calculator. Use those. Do not try to compute percentages because percentages don't work when it comes to sampling. And I won't get into all that now for the sake of time, but there are mathematical computations that go into the determination of a sample size, and it's not as simple as just we need 3% of our population. What is the evaluation time frame? Is it last visit, or are we looking back at the experiences of patients as the CAP survey does, for example, over the last 6 months? That's an important determination. We tend to use a lot of last visit surveys because it gives us a pulse of what's happening lately. How do we engage our staff to actually use the results? How do we make the results easy for them to access and also interpret and use? And what are the expectations? So if we've got multiple sites and we have a terribly low scoring site, what is the expectation of that site leader? Is it built into the process of evaluating the site and the managers? Do people understand the process? Do they know the questions that are being asked? You'd be surprised how often we'll launch a survey and employees don't even know what the questions are that are being asked of their patients. It's hard for them to focus improvement if they don't know what the measure is. And what are the expectations? Reporting, is it user-friendly for the right audience? So what we often do is we direct the reports towards the right stakeholders. So if we have a question about the call center, for example, we make sure that the call center manager is getting those scores. Sounds like common sense, but it doesn't always happen. Easy to access. I'll show you, we use links for reporting, and let me see if I can just briefly pull that up for you to give you an illustration. So we use a lot of online reporting, which works really well for senior leaders to be able to assess scores at a glance, make it quick. We often give it to them in a hyperlink format because we want to make it easy for people to access. We also use static reports, which are PDFs and other reports that are not dynamic, as in the case of that link we just saw. Easy to find reporting measures, very important that it's easy for people to get to. Things that you have to have in your survey, you have to have inclusive reach for the target audience. And what does inclusive reach mean? It just means that any patient who walks through your doors could potentially be surveyed. You don't want to leave people out. And again, that's the problem with some of the electronic modes, is that you will be excluding people that are not inclined to fill out an electronic survey due to access, reading level, or a host of other possible reasons. If you're only emailing or texting, you may be leaving them out. You also have to be careful with on-site or tablet surveys because staff will often drive who completes them. And if staff are driving who completes the survey, they're going to skew up in terms of scores because staff are going to cherry pick. There's no getting around it. I've seen it time and time again. It's very hard to avoid that if they are rating the staff. If they're not rating the staff, if it's just market research, those can work pretty well. Confidentiality of responses is really important whenever staff are being rated. So if you have questions asking how well the doctor listened, you got to make sure that that respondent is able to answer that question in a confidential manner. And then the quality of the design of the survey is really critical to ensure that the survey measures what you think it's actually measuring, that the reading level is appropriate, for example. Use vetted questions or test the survey internally if you're developing new questionnaire content. And if you're translating, make sure you're using a high quality translation and you're testing that as well. Granular response options. I see a lot of surveys with simple yes/no questions, like were the staff nice, yes or no? The problem with that is that nice is often a much more nuanced scoring than just a yes or a no. It's not a black or white, one or the other or binary. It's often somewhere in between. So we often convert yes/no questions into 4-point scales so that people can pick something that maybe is not so extreme in terms of one or the other. The new CAP survey version 4 has a lot of yes/no questions, which actually use a 3-point scale, which is yes very much, yes somewhat, or no for that very same reason. Keep it short if you're texting. Don't try to do a 35 question survey on a text. You're not going to get a good response. People don't have the patience to do that. If you're doing a call center experience survey, best to do it at the point of contact. What does that mean? If someone is calling your call center, if you can have built into that process, would you like to complete a 2-question survey at the end of your call? Press 1 for yes. That's the best way to get feedback about call centers. Promote awareness of the survey to your patients and staff whenever you have a survey in place. Encourage participation, not scores. Remind staff that the goal is top box. So in other words, what does that mean? If your staff are promoting the survey to patients, you want them encouraging patients to complete the survey, but not trying to manipulate patients into a top score like the car dealerships are famous for doing. And it's not enough to just not score low. I won't get into that in detail now for the sake of time, but that is a mindset that sometimes staff have, is that they're trying to avoid being perceived as not nice rather than trying to be perceived as excellent. Gateway questions we talked about earlier, so you want to make sure you have that, and then always have an NA option for each question so that patients can skip the question if it's not applicable. User-friendly reporting with longitudinal trend analysis is really important in your survey process so you can see what the trend is. Randomness of who the survey is administered to and when the survey is administered. In other words, you don't want to have survey week. And that's another mistake I've seen a lot of health centers make, is that they will say, okay, the first week of May, we're going to do the patient survey. The rest of the year, nothing. So what happens during that week? Well, Hawthorne effect. Everyone knows that this is survey week, so everyone's bringing out the A game, which does what? It skews the results higher, so you get a false read. User-friendly reporting is very important. So in terms of best practices, a couple of our clients have provided us some feedback in terms of how they use patient surveys. Urban Health Plan in New York, they meet with us every month. They dive into the reports and they share best practices, things that are working, and they can see if they're working based on those survey results. And then they cross-pollinate those across the organization. They share them in huddles, department meetings. They engage the staff, basically. It's not just a leadership exercise. It goes all the way down to the frontline staff. They do a lot of recognition. They do PSR, for example, the month or the quarter, the site of the month or the quarter, and even the year. So they really ensure that it's part of their culture, service excellence. And at one of their sites, this manager shares customer service experience that they've had in their personal life and use it as an illustration of how they can translate that behavior into their practice. Some other health centers we work with, Lynn Community Health Center and East Boston Neighborhood Health Center. Lynn sends an email with a single-page document that discusses a topic associated with patient satisfaction, highlighting tips and tricks and best practices to help them navigate difficult situations. So they kind of focus, the questionnaire has many questions on it, and they focus on one question and how to improve that area each month. And then they've also said they found that using small parts of the survey, again, to focus in on projects is helpful, such as their PAP project specific survey to manage the backlog of cervical cancer screenings, pharmacy survey. So they have targeted surveys that focus on particular areas, and that's been very helpful to them. So went fairly quickly there, covered a lot of ground. I wanted to leave some time for any questions or provide any answers to those questions that you may have, either about the survey process itself or about how to best use your survey results. And Jocelyn, if you saw any questions come in, feel free to share those as well.
Not seeing anything in the chat or the Q&A just yet.
I have a few that have come in, Mark.
Yes.
Okay, the first one is, how long does the survey process typically take, and how much time should we schedule for it?
Well, we generally recommend that the survey process be baked into everything you do on an ongoing basis. So in that case, you're getting a random sample of patients continuously. You don't have to survey all your patients. Random sampling is really, really wonderful because it allows you to be a lot more efficient, and reduces the burden both on the survey process and on respondents. So I recommend having it ongoing and having monthly, at a minimum monthly reporting, getting streaming reports that are real time. So if a patient walks in Monday, they can be contacted Tuesday, results can be provided on Wednesday, and just have that ongoing, and use your streaming comments and scores for service recovery purposes and for rapid feedback to keep a pulse on what's happening, but then use your longer term periods such as months and quarters to really gauge what the trends are. So as far as how long, just all the time.
Great. Second question, how do you deal with CHCs with multiple, whose patients speak multiple languages?
Yeah, that can be challenging. Really depends on the mode of the survey, how it's being administered, but you want your survey process obviously to include all languages. Usually most organizations are primarily English and Spanish, so those should be standardized. If you have staff that speak those languages, I would involve them. And if your vendor can complete the surveys in those languages, then that's ideal. If you have, let's say you're implementing a telephone survey and you've got 3 languages that are being interviewed by phone in those languages, but then you have a small group of, let's say, Somali patients, and you don't have, vendor doesn't have the capability to complete surveys in Somali, then that's where you look at other modes of electronic survey, or even paper survey or kiosk surveys in some cases, to reach those patients in their language. But you want the survey to really pick up all of the languages that represent your patients.
Wonderful. And one more question is, how long does the onboarding process typically take with Crossroads to get started? And once you do sign on, how long does it typically take to get a survey started?
Yeah, typically it's a 30 to 90-day window. There's 2 things that we need from clients when we start up a project. And how long that takes really depends on the client. One is the design of the survey itself in terms of the questions that are selected. So we provide a question bank of over 200 questions, and we provide some guidance in terms of what are the most commonly used and benchmarked questions. So once the questionnaire is selected and the questionnaire is finalized, the other piece is the working with the IT department to automate the data pulls in a secure manner. So we use those encounter pulls for sampling. And so that IT piece and that questionnaire design piece usually take between 30 to 60 days. And then once that happens, we're off to the races, and then we do everything from there.
Terrific. I don't see any other questions at the moment. Let me double check. Nope, that's it. Well, Mark, thank you so much for this very informative webinar. And we really appreciate it today. It was wonderful. So thank you very, very much.
Great to be with you all. Thank you all for your time.
All right. Have a great day. Thank you, everyone.
Take care.